Dear friends, in this webinar, we will learn about indications and preparations required for endotracheal intubation in a neonate. The common indications of intubations are ineffective bag and mask ventilation, requirement of prolonged positive pressure ventilation, and chest compressions are required during resuscitation. When surfactant administration is indicated, diaphragmatic hernia is there. The equipments required for intubations are laryngoscope, one extra blade, endotracheal tube, stellate an optional thing, CO2 monitor, suction catheter, tape, seizure, oral airway, meconium aspirator, stethoscope, self inflating bag or flow inflating bag or T-piece resuscitator, pulse oximeter, laryngeal mask airway and gloves. The pulse oximeter is required for monitoring during intubation. One should always ensure selection of appropriate equipments and ensure their optimal functioning before intubation. The appropriate size blade should be selected for intubation. Blade size 1 is to be used for full term neonates, size 0 for preterm and low birth weight babies, and blade size 00 is to be used for extremely preterm neonates. One should always remember and ensure that it is working with adequate light and one extra blade is always there. Size 2.5 is appropriate for less than 1000 gram or less than 28 weeks gestation newborn. Endotracheal tube size 3 should be selected for 1000 to 2000 gram newborns and 3.5 centimeter size for newborns more than 2000 or more than 34 weeks of gestation babies. Any additional item like tape or dynaplast for securing the tube must be prepared before, and suction equipment must be set at 80 to 100 mm of mercury pressures before the procedure. For endotracheal tube of size 2.5, suction catheter of size 5 or 6 French gauge is appropriate. A simple formula for calculating the actual size of suction catheter is approximately double the size of endotracheal tube size. Resuscitation bag will help in ventilating the baby as well as to confirm the tube placement by auscultating for equal bilateral air entry. Endotracheal tube is to be fixed at tip to lip distance of weight in kg plus 6. For example, in 1 kg baby, endotracheal tube is to be fixed at 7 centimeter. For 2 kg baby, it is to be fixed at 8 centimeter. For 3 kg baby, it is to be fixed at 9 centimeter tip to lip distance. So on. A recent method for estimating the depth of insertion is estimation using nasotracheal length, that is nasotracheal length plus 1 centimeter, where the nasotracheal length is distance from nasal septum to ear tragus. The depth of estimation should be confirmed by equal breath sound on auscultation post intubation. So, we learnt about indication and accessories required for tracheal intubation. One should always remember that endotracheal intubation should be a well planned procedure and ensure that all required accessories are available before intubation. Intubation should be done under monitoring with pulse oximeter. Size and depth of insertion should be determined before intubation. Thank you.